Dear colleagues, the topic of our lecture is scoliosis. This disease is quite relevant because in Ukraine, for example, more than 180,000 children have scoliotic deformity, but there are not enough specialized centers that can provide proper surgical care. Let's start from definition. Scoliosis is a lateral curvature of the spine in an upright position, which is necessarily accompanied by rotational deformity. The curves are fixed, non-flexible, and fail to correct with side bending. Lateral bending of spine is asymmetric or involved vertebrae are fixed in a rotated position, or both. This leads to the following problems like a cosmetically unacceptable deformity, biomechanical disorders, dysfunction of vital organs like lungs, heart by overcrowding the ribs. The thoracic spine is the most common site of scoliosis. Thoracic scoliosis is generally associated with deformity of the rib cage as well as the spine itself. The curvature becomes clinically apparent because of the rib cage asymmetry that develops. In thoracic region, the rib on the convex side stand out predominantly and produces rib hump. These changes are accompanied by high standing of diaphragm, disposition of heart and lungs. On this slide we can see left side scoliosis, which is characterized by rib cage high on one side, one hip high or more prominent than the other, the waist uneven, the body titles to one side, one leg shorter than the other, Cobb angle is 89 degrees. This is an example of right side scoliosis with a similar clinical picture. With scoliotic disease, disorders of vital organs develop. On the part of the lungs, changes occur in the form reduction of pleural cavities and disturbance of mechanics of breath owing to rapprochement of ribs on the concave and convex side of deformation result in development of sites atelectasis and emphysema. It is the starting mechanism of development of disturbance of external breath. Atelectasis and emphysema of lung and also a spasm pulmonary capillaries result in difficulty of a blood groove in system pulmonary arteries. If we talk about changes in the cardiovascular system, then the hypertension in a small circle of blood circulation result in a hypertrophy of a myocardium and dilatation cavities of the right heart that is an attribute of pulmocore insufficiency on type cor pulmonale. The first step toward getting an scoliosis diagnosis is typically the Adams forward bend test, which primarily looks for abnormal spine rotation. This test involves a healthcare professional observing the patient bending forward at the waist 90 degrees with arms stretched towards the floor and knees straight. From this position, most scoliosis signs that present as asymmetry are clearly visible in the spine and or trunk of the body, such as one shoulder or shoulder blade is higher than the other, rib cage appears higher on one side, one hip appears higher or more prominent than the other, the waist appears uneven, the body titles to one side, one leg may appear shorter than the other. The Adams forward bend test can be useful in detecting scoliosis located in the upper or mid back, which is where idiopathic scoliosis usually occurs. However, the forward bend test is not as effective at detecting scoliosis in the low back because it does not involve rib rotation. Major curves, also called primary curves, are the largest abnormal curves in the scoliotic spine and the first to develop. Minor curves, also called secondary curves, are smaller and are considered to develop afterward, to compensate for the perturbation of balance that accompanies to progression of major curves by repositioning the head and trunk over the pelvis to maintain balance. Scoliosis can be idiopathic, congenital, paralytic. Idiopathic scoliosis most frequent. It could be infantile, less than 5 years. Curve could be progressive or regressive. Juvenile, 5 to 10 years. Adolescent, more than 10 years, and adult. Congenital scoliosis occur due to defect in segmentation, defect in the formation including hemivertebra or double hemivertebra. The cause of paralytic scoliosis are poliomyelitis, muscular dystrophies. This slide lists the cause of paralytic scoliosis, including neuropathic causes, muscular, neurofibromatosis, miscellaneous. Scoliosis can be classified according to the segment at which the deformity occurs. This could be cervical, C1, C6 segment, cervicodorsal, C7, T1, thoracic, T2, T11, thoracolumbar, T12, L1, lumbar, L2, L4, lumbosacral, L5, S1. Cobb angle measurement. The lateral curve of scoliosis is described by the Cobb angle. Using an X-ray of the full spine, the Cobb angle is found by drawing a perpendicular line from the spine's most tightal vertebra above the sideways convex apex and a second perpendicular line from the most tightal vertebra beneath the apex. The angle formed where those two lines meet is the Cobb angle. How the Cobb angle is measured? The apex vertebra and the most tightal vertebra above and below the apex are used to measure the Cobb angle. A Cobb angle of at least 10 degrees is typically considered the borderline for a scoliosis diagnosis. Depending on the measured major curve, 4 degrees of deformation can be determined. First degree from 5 to 10 degrees, second degree from 11 to 20, third degrees from 21 to 40, and the last more than 40 degrees. Index stability scoliosis is a degree fixity of deformation. It's necessary to determine two angles: angle of deformation alpha in position of the patient laying and angle of deformation beta in position of the patient standing. If the index stability scoliosis equal 0.5 to 1, it's a stable deformation, which means a poor prognosis in treatment. This slide shows how the compensation or secondary curve is formed, which develops above or below the primary curve in an effort to balance the spine. Let's talk about the treatment. First of all, about general guidelines. Curves of less than 20 degrees in skeletal immature persons are examined every 6 months. Curves more than 20 degrees in skeletal immature persons should be examined every 3 to 4 months. Orthotic treatment for curves more than 25 degrees. Curves less than 20 degrees in skeletal mature persons require no further evaluation. Curves more than 30 to 40 degrees in skeletal mature persons do not require treatment, but they are examined radiographically for progression every 2 or 3 years. Here we can observe various options for non-operative treatment, which is used for curves of more than 25 degrees. We see Milwig brace, Boston brace, racer's turnbuckle cast, and other. The research classification is used to grade skeletal maturity based on the level of ossification and fusion of the iliac crest apophysis. It is primarily in planning corrective surgery for scoliosis. Classification. Stage 0. No ossification center at the level of iliac crest apophysis. Stage 1. Apophysis under 25% of the iliac crest. Stage 2. Apophysis over 25 to 50% of the iliac crest. Stage 3. Apophysis over 50 to 75% of the iliac crest. Stage 4. Apophysis over 75% of the iliac crest. Stage 5. Complete ossification and fusion of the iliac crest apophysis. As stage 0 and stage 5 can appear similar, age and long bone growth plates may be of help in discriminating the two. A patient with stage 0 will still have open growth plate in most of the long bones and will likely be younger than age 16 for female and 18 for male. A patient with stage 5 will have no open growth plates in the long bones. Surgical treatment is indicated. For high degree thoracic curve, non-operative treatment are not effective in thoracic spine. Curve is over 40 degree. Distraction technique. It's an old method of treatment and rarely used. It includes halopelvic distraction, halofemoral distraction. If we talk about modern technique, there are methods like growing rods, vertical expandable prosthesis titanium rib, tangent-based devices, growth-guided devices, and others. These are examples of various surgical techniques for treating scoliosis. For example, the differences between a traditional growing rod system and a magnetically controlled growing rod surgery is that a magnetically controlled growing rod allows rod lengthening without general anesthesia and a surgical incision. Each magnetically controlled growing rod contains a small magnet. An external remote control device triggers the magnet to change the size of the rods while the child is awake in the surgeon's office. These are examples of posterior fusion methods. Character instrumentation is a method in which the device itself was a stainless steel distraction rod fitted with hooks at both ends and attached and was implanted through an extensive posterior spinal approach, the hook being secured onto the vertebral lamina. It was used at the beginning without performing a spinal fusion, but early results proved fusion as part of the procedure was mandatory, as movement of the unfused spine would cause the metal to fatigue and eventually break. The procedure required the use of a post-operative plaster cast or bracing until vertebral fusion had occurred. And in the end, quick facts. Scoliosis is lateral curvature of the spine. Idiopathic variety accounts for 90% of cases. Female preponderance. X-ray is the only definite documentation of curve size and progression. The most important aspect of treatment is early detection. Curves less 20 degrees need observation. Curves more 20 degrees require treatment.